Good afternoon, everyone. Thank you for being with us today. I want to also thank the dozens of people on the response team who worked so hard behind the scenes to inform the measures and approach that the governor discussed that we will be taking for the next few weeks and months. There are armies of people that have been involved with that. Rhode Islanders can be assured of that. I'll start with an overview of the data. We have 203 new COVID-19 cases to report today. We continue to have a robust testing program, and we'll see the cases associated with that. There are 272 patients who are currently hospitalized. Of these people, 63 are currently in the intensive care unit, and 41 of those 63 are currently on a ventilator. We unfortunately have 11 additional COVID-19 associated fatalities to report this afternoon. One person was in their 60s, 4 people were in their 70s, 2 of these people were in their 80s, and 4 of these individuals were in their 90s. We want to make sure it's known that our deepest sympathies are with the families of those we have lost. I know that everyone is going to be eager to ask questions about the approach that the governor has just outlined in terms of our movement between phases, but there's been a lot of news over the last day or two about the Abbott ID Now test, so I want to take a moment to address that. The Abbott ID Now tests are the tests being used at the testing site at Twin River. The FDA announced yesterday that it is going to be looking at the Abbott test. It's a rapid test that's used to identify COVID-19. They are looking specifically at accuracy issues and are investigating whether they could be due to the types of swabs used or the type of viral transport media used, which is the material used to transport the specimen safely and effectively. It's important to know that we validated the Abbott tests at the Rhode Island Department of Health's state health laboratories when we started using them in Rhode Island. Our state health laboratories confirmed their accuracy. It's also important to know that our positivity rate at the Twin River site is about 11%, which is essentially the same as our positivity rate in Rhode Island for all tests at all sites. So it is comparable, and that's information that's helpful for us. Abbott tests have been very useful for us in Rhode Island. They've allowed us to start contact tracing on thousands of people very quickly and to get them into isolation very quickly. The key for us staying in front of this as a state is being able to identify the people who have been exposed, who are positive, and quickly get them into isolation, identify their contacts, and get them quarantined so that they can stay local, stay close to home, and monitor themselves for symptoms. That's the way to stop transmission. That is the greatest value that we get from these tests. However, we know that there are limitations to any test. One limitation to the Abbott test is that it is a little less sensitive than a lab-based PCR test that we're using. It is a point-of-care test. That means for the Abbott test, as well as for our lab-based PCR test, in a normal scenario, the test is one piece of information that a healthcare provider in the office would traditionally use when evaluating a patient. We understand that. It's one tool in the toolbox, and it is a critical one. A person's symptoms are also an incredibly important piece of information. That's why we have been saying for weeks that no matter what your test result says, it is extremely important for people to stay home and self-isolate if they have symptoms. We've also explained for the last several weeks that the test works less accurately, less reliably, if it's done on people without symptoms. And that's why we are only using it in those situations for specific reasons driven by the Department of Health when we want to use it to inform how we are evaluating the spread of disease. It's also why we have formed the Rhode Island COVID-19 Testing and Evaluation Task Force. We are very appreciative to these experts who have committed time and are already fully engaged in evaluating this test, the FDA antigen tests, the serology tests, to help make sure that all of us in Rhode Island have the information we need about how to use the tests best to our advantage. We are using many different tools to comprehensively understand the prevalence of COVID-19 in Rhode Island and to make data-driven, informed, science-based decisions about our next steps. I do want to close by reiterating that testing is still very important and very valuable. If you have symptoms, we want you to call your doctor. Engaging your healthcare provider is so important. Even if you go online and make an appointment through CVS to get tested at Twin River, it's helpful to let your healthcare provider know as well. Continuing to stay engaged with your healthcare provider so that you can get the support that if you have symptoms, no matter what the test result is, you continue to stay home and to isolate, and to help make sure that there's no spread of any kind of illness, COVID-19, influenza, or any other viral illness that occurs. Having a positive or negative test result is one important piece of information to have when making decisions about what steps to take to keep those around you healthy and safe. We have and will continue to amplify the message that testing is important, being able to social distance effectively, having more than 6 feet in between yourself and others in public is important, being able to wash your hands, use hand sanitizer regularly is important, being able to have some form of cloth face covering is important, whether a mask or a scarf if you don't have access to a mask, making sure that you're washing it. And as we've said since the very beginning, if you have symptoms of any kind, staying home and recovering safely there is important. Call your healthcare provider, call an urgent care center, get evaluated, and get tested, knowing that all of those steps are going to be critical for us to continue to move from the phase we're in to the next phase safely and effectively as we reopen our economy here in Rhode Island.